become mother after 20 years or 25 years, she should be healthy. So in early childhood, what we can do? Promoting breastfeeding. Avoid sugar. There is no need to give the sugar to a child who is newborn, maybe after 3 months or 6 months, when you want to give her other than the mother milk. From outside, when we want to give the milk, don't give the sugar. Sugar is a chemical, it's not required. Neither God had given sugar in the mother milk nor in the cow milk. So there is no need. Don't increase the sugar content of the diet. Responsive feeding, don't just go and feed the child, don't make her overweight, controlling screening time, risk assessment, and our pediatrician also to be educated for the same. School going children, we have to do a kids, we are doing already a kids program, there's knowing diabetes in school, that's an International Diabetic Federation program. We also teach the teachers, educating them that, giving them a health science booklet, growth monitoring, and screen them for obesity. And same thing we have to do again in the higher school or the junior college for the teenagers and adolescents, and we have to create them a digital health engagement. A nutrition workshop has to be done for them. A young adults, a reinforcement of a healthy habits. And most important thing, the fitness challenge and incentivize them. Incentivize those who are fit and standing culture. And this is most important thing which I wanted. That's the reason I asked when Dr. Makkar had finished his talk that let us give him a standing ovation. Because the standing culture we have to develop in our society. Everyone we should stand for more period of time. In a middle-aged adults with 45 to 65, preventing sarcopenia. They are at the highest risk of developing cardiovascular disease. And regular health checkup, nutrition counseling, because we are protein deficient. We have to increase our intake in protein, and that's very, very important. Above the age of 65, many of us may have sarcopenia, many other problems also, and they are also to be treated because primary prevention, secondary prevention, that has to be continued. So we are trying to do for the young adults, they should not develop the diabetes in their 30s and 40s. So this is a very multi-pronged approach. We all know that urbanization, unhealthy diet, sedentary lifestyle, lack of exercise and stress. All of you know that these are the reasons for increasing diabetes in our country. And this is preventing obesity, preventing conversion from pre-diabetes to diabetes, or a preventing complication. This is what we can do, and we are doing as a doctor, because all those who are coming to us, they are already urbanized, unhealthy diet they are taking. But if you want to primordially prevent diabetes, we have to think for maternal health, we have to think of maternal nutrition, and we have to think of in utero environment. And that will give us normal birth weight, healthy newborn, less insulin resistance, less risk of obesity and diabetes. If we do it, it is going to give us generational impact. So first generation, second generation, or maybe third generation may not be your next daughter or son will come with a 3.1 kg body weight with the normal fat percentage, but maybe her son, her daughter may have. So maybe generational impact we are going to have with this. For this, the same, we made our Honorable President of India just before some time. Some of us were there, Dr. Makkar was there, Dr. Shashank was there, Dr. S.R. Arvind was there, many of us were there. We talked to her regarding how we can think of primordial prevention of diabetes in future generation. And this chapter which we had given, that yes, it can be done. From if we work on a young girls, making them a healthy mother, creating a healthy school environment, creating a healthy youth environment, and probably a diabetes-free adults. For that, we have to invest in the health of female child. We have to create these healthy habits in early childhood. In school curriculum, the health and fitness booklet has to be there. Workplace, start creating a standing culture. In your clinic also, in a consulting also, do only standing culture. Keep your patient and yourself both can be in the standing and do consulting and even standing also. Incentivize the healthy habits. Those who are fit, those who are healthy, those who have their abdominal girth is absolutely normal, they should be more incentivized in your office, everywhere. Above the 45, regular health checkup, prevent complication, and above the age of 65, definitely preventing sarcopenia. But sarcopenia is a problem again. As I told you, from young age only, we have to create a habit of increasing protein intake, because that's only 10% what we do. So can we really change the natural history of type 2 diabetes? Yes, we can change. We can completely close the gates for diabetes. And just before some time, we have done a dedicated meeting, World Congress of Prevention of Diabetes in Mumbai, and to know more about diabetes prevention, more about the diabetes problem, and along with that Mprssdi National Conference, which is going to be there in Delhi from 14th to 17th of November. Along with that, there are 2 days, 15th and 16th, where we are going to do a IDF Southeast Asia Congress also. So that's on Friday and Saturday, and from Thursday to Sunday, we will be having our meeting of diabetes. With this, once again, thank you Mprssdi MP chapter, and let's close the gate for diabetes. Thank you very much, thank you. I was sure that everybody will stand, but this is a culture of standing. I don't want a standing ovation. This is a culture of standing which we want to develop.